Dementia affects 50 million people worldwide, and the number of cases is expected to reach 152 million by 2050. Healthcare technology company Smart Brain Aging has developed research-based programs, BrainU Clinic and BrainU Online, which are designed to help prevent cognitive decline and reduce the impact of the condition as we age. Steve Mortz went to Arizona in America to see how these programs can be used to help keep our brains healthy.
Dr. John Denbour meets with a patient at her home in Arizona. He says he's made it his life's work to help people with dementia, establishing Smart Brain Aging in 2016.
My grandmother, who was extremely important in raising me, started developing dementia. And noticing this decline in her helped me start thinking about ways that we could help early identification and prevention of the disease.
Today, Denbour is working with Verlene Rader. She signed up for Smart Brain Aging's Brain University program, or BrainU. It's designed to improve quality of life for those with mild cognitive impairment or early-stage dementia. The program involves working on brain exercises with a trained professional.
I think it can help a lot. It keeps you thinking, keeps you off the couch and trying to improve.
These exercises are tailored to each person's specific needs. Some participate at home, others come to Smart Brain Aging's clinic. Smart Brain Aging's programs are based on years of research involving more than 3,000 study patients. And the work being done here is helping push forward the science of brain health.
We do randomized clinical trial research that's double-blind, placebo-controlled. We partner with UCLA, other institutions. This is a brain of normal size. But what happens in dementia is that the brain cortex can shrink.
Denbour says this research shows it's possible to mitigate the onset of dementia.
Simple brain activity is not enough. Through the use of new and novel brain exercise, doing things that are incredibly novel and rigorously novel with the brain, we can help prevent and intervene in that part of early stage dementia.
BrainU can even be used before any problems are detected. Patricia Wallace says she wants to prevent possible future cognitive decline.
Somebody had asked me the name of the street, and I'd say, well, I can't think of it right now, or something like that, you know. You just wondered why that was happening, so I just thought I needed a little bit of help.
Wallace is one of several residents in her independent living community who've signed up for BrainU. Dozens of similar facilities recommend it to their residents.
Why can't we be proactive and start helping people ahead of time? Really keep it at bay and do the research on the front end as opposed to the back end.
So this is the dashboard?
BrainU is also available online.
This
is an example of an exercise.
Exactly. Here's an example, and this says click all the 6s and 7s.
Smart Brain Aging's Chief Technology Officer Faisal Kokadai says BrainU Online's app allows patients to work on puzzles, either on their own or in a virtual classroom, over a 6-month period.
There are word exercises, there are drawing exercises, there are memory exercises. For example, we were doing one where you read off 5 words, and then it goes through 10, 12 other exercises. And then it asks you to put in those 5 words again.
An estimated 47 million people worldwide are now living with dementia. That number's expected to increase to 75 million by 2030. But experts say tools like Brain University may offer hope in the fight against what remains a mysterious disease.
Diabetes, obesity, cancers are chronic diseases that we have much more knowledge about, and there are interventions that can be applied to these types of diseases. Whereas with dementia, there is no cure to date.
But despite his successes so far, Denbour says much work remains. Studies are currently being carried out at Harvard, UCLA, and the Translational Genomics Research Institute, which Denbour hopes will improve programs like BrainU.
We need to really proliferate research in this particular area where other products, us and other products, can get out to the mass public so they can start utilizing these products when they start getting into the late 50s and early 60s. only then can that really help diffuse this cortical atrophy and help prevent the progression of dementia.